Here are 6 high-yield USMLE-style questions focused on collagen types, their functions, and associated disorders. Question 1. A 3-year-old boy presents with brittle bones, frequent fractures, and blue sclerae. Genetic testing reveals a mutation in the gene encoding type 1 collagen. Which of the following is the most likely diagnosis? A. Ehlers-Danlos syndrome, B. Osteogenesis imperfecta, C. Marfan syndrome, D. Scurvy, E. Answer. B. Osteogenesis imperfecta. Explanation. Osteogenesis imperfecta, OI, is a genetic disorder characterized by brittle bones due to a defect in type 1 collagen, which affects bone strength and integrity. The classic features include frequent fractures, blue sclera, and hearing loss. Type 1 collagen is the most abundant form of collagen, found in bones, skin, tendons, and other connective tissues. Question 2. A patient with frequent nosebleeds, easy bruising, and hyperelastic skin is diagnosed with a collagen disorder. Biopsy reveals a defect in type 3 collagen, a key structural component of blood vessels and skin. Which of the following is the most likely diagnosis? A. Osteogenesis imperfecta, B. Marfan syndrome, C. Ehlers-Danlos syndrome, vascular type, D. Alport syndrome, E. Scurvy. Answer C. Ehlers-Danlos syndrome, vascular type. Explanation. Ehlers-Danlos syndrome, vascular type, is caused by a defect in type 3 collagen, which is important for the integrity of blood vessels, skin, and early wound repair. This form of Ehlers-Danlos syndrome presents with easy bruising, hyperelastic skin, and a risk of vascular rupture. Question 3. A 14-year-old girl presents with progressive hearing loss and renal disease. Urinalysis shows hematuria, and renal biopsy reveals basement membrane abnormalities. Which type of collagen is most likely defective in this patient? A. Type 1 collagen, B. Type 2 collagen, C. Type 3 collagen, D. Type 4 collagen, E. Type V collagen. Answer. Type 4 collagen. Explanation. Alport syndrome is caused by mutations in type 4 collagen, which is a critical component of the basement membrane, e.g. glomerulus in the kidneys, cochlea in the ear, and lens of the eye. This disorder leads to hematuria, renal failure, hearing loss, and ocular abnormalities. Question 4. A 25-year-old woman with hyperelastic skin, hypermobility of joints, and a family history of similar symptoms. Which type of collagen is most likely deficient in this condition, and what is the most common genetic inheritance pattern? A. Type 1 collagen, autosomal dominant, B. Type 2 collagen, autosomal recessive, C. Type 3 collagen, autosomal dominant, D. Type 4 collagen, X-linked recessive, E. Type V collagen, autosomal recessive. Answer. C. Type 3 collagen, autosomal dominant. Explanation. Ehlers-Danlos syndrome hypermobile type is most commonly caused by a defect in type 3 collagen, which is important in the skin and blood vessel structure. It is typically inherited in an autosomal dominant pattern and presents with hyperelastic skin, hypermobile joints, and a tendency for bruising. Question 5. A 40-year-old male presents with tall stature, long limbs, pectus carinatum, and aortic root dilation. Genetic testing reveals a mutation in the fibrillin gene. Which of the following collagen types is most likely involved in this condition? A. Type 1 collagen, B. Type 2 collagen, C. Type 3 collagen, D. Type 4 collagen, E. Type V collagen. Answer. V collagen. Explanation. This patient is likely presenting with Marfan syndrome, a disorder of the connective tissue caused by a defect in the fibrillin 1 gene. While fibrillin itself is not a collagen protein, it is involved in the organization and elasticity of the extracellular matrix, which includes collagen types. Marfan syndrome often leads to aortic root dilation, pectus deformities, and long limbs. Type 1 and Type 3 collagen are more directly associated with bone and skin, but the primary issue in Marfan syndrome is with fibrillin and connective tissue. Question 6. A patient with chronic kidney disease develops retinal abnormalities and deafness. Kidney biopsy reveals defects in the basement membrane. Which collagen type is most likely defective in this patient? A. Type 1 collagen, B. C. Type 3 collagen, D. Type 4 collagen, E. Type V collagen. Answer. D. Type 4 collagen. This patient likely has Alport syndrome, which is caused by a defect in type 4 collagen. This type of collagen is essential for the basement membrane in various tissues, including the kidneys, glomerulus, cochlea, and eyes. The characteristic features of Alport syndrome include renal dysfunction, sensory neural hearing loss, and ocular abnormalities. Here's a USMLE style question that incorporates the SCAB mnemonic for collagen types. Question: a 25-year-old male presents with brittle bones and frequent fractures. He also has blue sclera and a history of hearing loss. Genetic testing reveals a mutation in the gene encoding type 1 collagen. Which of the following is the most likely function of type 1 collagen? A. Bone strength and structure. B. Cartilage formation and joint function. C. Artery wall integrity. D. Basement membrane structure. E. Cellular signaling and receptor binding. Answer: A. Bone strength and structure. Explanation: type 1 collagen is the most abundant collagen type and is primarily responsible for the structure of bones, which is why it is affected in osteogenesis imperfecta. It is also found in skin, tendons, fascia, dentin, cornea, and late wound repair. The SCAB mnemonic can help you remember the primary functions of different collagen types. S. Type 1, skeleton bone. C. Type 2, cartilage. A. Type 3, arteries. B. Type 4, basement membrane. Thus, type 1 collagen is crucial for bone strength and is responsible for skeletal integrity. This question integrates the SCAB mnemonic to reinforce the functions of various collagen types. Let me